Hello everyone. For my community project, I did mine through the city of Greenfield. I focused on how to stop the spread of infection in the community, mainly in the schools. So in assessing the community of Greenfield, I determined that stopping the spread of infection, especially in schools, was an area that should be focused on. By doing this, I focused on hand washing, since hand washing is one of the best ways to avoid getting sick and spreading germs to others, and also removing germs from our own bodies. So through my community and then my windshield survey, so my community is Greenfield, which is a suburb of Milwaukee County. The community has a population of about 36,921 people. When doing my windshield survey, I focused on the elementary schools. So there are 3 elementary schools in the district. The elementary school that I decided to do my community project on was Maple Grove Elementary. Other high infection rates for the spread of infection would be daycares and nursing homes. Greenfield does have good access to healthcare with multiple clinics, including urgent cares, a standalone hospital, and multiple specialty clinics. So a community assessment helps to be able to identify improvement priorities, increase public awareness and progression opportunities, provide measurable goals, and identify research, evaluation, and data collection needs. When assessing Greenfield, I found out that it is not a very diverse community. 77.3% of the community is made up of non-Hispanic white Americans. White Hispanics make up 7.37% and 4.84%, as well as 4.84% are made up of both Asian and African American. Looking at the community in regards to COVID, which was my main focus for this project, the age group of 25 to 34 did make up a total of 22% of the total positive cases, and the age group of 0 to 17 with 21% of the total cases. And then overall, there is good access to healthcare in the community. My nursing diagnosis I came up with was risk for infection among school-age students in the Greenfield community related to lack of knowledge on how germs are spread. My partners and resources for this project. So my main partnership was with Casey Rice, who's a nurse practitioner, and also my liaison. She is the one who I brainstormed most of the ideas from and came up to, based on her practices, what a high need in the community of Greenfield is, which we did determine to be hand washing to help to stop the spread of infection, mainly in schools. And then the principal of Elementary Grove, as well as the 4th grade teacher, Mr. Alms, whose classroom I went into to present this project, were vital parts of the project because they gave their insight as far as how they saw this benefiting the students of the elementary school, as well as allowed me to come in to present to the students. The main resource that I used was the local Greenfield Health Department. There I found the most up-to-date information in regards to anything that was needed to know on COVID, as well as information on what the Greenfield community is made up of. The other resource was the Center for Disease Control and Prevention. I got most of my information as far as hand washing processes and then ways that we can decrease the spread of germs and infection, mainly due to COVID. And then the Greenfield School District COVID dashboard, which is shown in table 1 below, gave a quick look at the rises and falls in the positive cases in the entire Greenfield School District. So my community health plan, I created a pamphlet that students could take home to the family, presented the project to the students, performed a hand washing experiment with the use of glow germ with the students, and then it would evaluate if this experiment was successful. The picture on this slide does show one of the aftermaths of using the glow germ experiment, where the students were able to see the spots that they did well on cleaning their hands, and then the spots like the fingernails and cuticles that could use some more work. Short-term goal 1 for my project was the students will be able to use teach-back method to demonstrate to other students and Mr. Alms the proper way to wash their hands by the end of the class project. This will then be evaluated by Stephanie, the student nurse. Short-term goal number 2, the students in the class will be able to demonstrate to Stephanie, the student nurse, the proper way to wash hands during the class project. This will be assessed by using the glow germ and blacklight to show if all the germs were washed off with the use of soap and water, hand sanitizer, or antibacterial hand wipes. The long-term goal, the school will see a decrease in the number of students absent from Mr. Alms's 4th grade class due to illness over the next month. My interventions were I created a pamphlet that the students would be able to take home with them, which I will show at the end of this PowerPoint presentation. With the use of glow germ, I will teach the students the proper way to wash their hands, which is washing your hands for at least 20 seconds or by singing happy birthday twice in warm water, and then making sure that they scrub the back of the hands and the fingernails because those are the most missed parts. And then we use 3 groups in this presentation experiment: soap and water, hand sanitizer, and antibacterial wipes to see which was most effective. So short-term goal 1 was partially met. Students did well on teach back but did get distracted towards the end, so maybe not having as many students do teach back would be more appropriate, just to keep attention so that things did not get sidetracked. Short-term goal 2 was met. This was evaluated with the use of the black light to see if all the germs are washed off the hands. It was determined that soap and water was the best intervention to remove germs if hands are soiled. Long-term goal has not been met yet. This will be evaluated by looking at the Greenfield School District's COVID dashboard about a month after the presentation, which will indicate the number of students absent in classes daily. Also contacting the school to see if the number of students absent in Mr. Alms's 4th grade class has been decreased over the last month. And then while assessing the community of Greenfield, it was determined that there was a lack of knowledge on the proper way to wash your hands. A community diagnosis was created that focused on infection prevention. This project was successful in educating the students in the classroom. Overall, this community project will not only help the students that were taught the importance of good hand hygiene, but will also make it to the community through these students by them sharing what they had learned. This is just a list of my references that were used. This shows the handout that I sent home with the students. It goes over the important times that hands should be washed, as well as goes over how to wash your hands properly when they are soiled, and then does go over the use of sanitizer, how it should have at least 60% alcohol if soap and water is not available. This last slide here shows the effects of the glow germ experiment. The picture in the bottom right shows a spot on the hands that was missed when washing hands, as well as the picture above it. The picture in the middle shows fairly good hands that were cleaned except for around the fingernails, which the students found to be the most hard spot to get cleaned. And then just a picture with myself and some of the students with the billboard type poster board that I made to show the students during my presentation. Thank you very much.